I would be looking at the force application there if we were in clinic. Yep, and then relax. And so, yes, some supraspinatus / subacromial pain symptoms, but he was okay with the TOES test, reducing our like the extent at which his supraspinatus may be involved. If there was more involvement, he may not be able to hold that. We go into our resisted external rotation. I encourage you to test throughout the range and then to buttress on the inside of the elbow. So go ahead and actively push out at me. And then what I'm, go ahead and relax. So your motion is going to be like this. Yep. And then go ahead and I'll let you win as you push out into me. And so I'm getting a sense of his strength throughout the range rather than just an isometric in that one position. And then I'm making sure that he's not abducting by having that secondary buttress here. Again, handheld dynamometry is optional if you so choose. And then now hold strong, but let me simultaneously win. So you're looking at the contractile tissue under eccentric load, which is usually more of a provocative test, and that's why I start with the concentric. The next sequence really is not going to be applicable in Tree's instance because what we're looking for is a complete rupture or a significant implication where you go through your pate sign and your drop sign, which is essentially they're essentially the same test, just at different degrees of abduction. So first is like this, right, where I go like this, and then he would potentially fall in, or I would offer resistance. The last one up there is horn blowers, where it's like this, and then hold strong. I would offer gentle progressive resistance at the back of the wrist. If they can't hold it, right, usually what they will do if they will, again, kind of horn blowers, that's how it gets its name, they will flex at the elbow as a means of a resistance. Not all people will go into that compensatory motion. So keep in mind that you're also just looking at force, a gross screening of force, but it is more of like a provocation. You're really trying to determine whether the contractile tissue is intact or otherwise.
Michael, so for horn blowers, because biceps like secondary function is a shoulder flexor, that's why they like when they have a rotator cuff tear, they go into that function because the biceps is like overriding that function. So like that will help you kind of remember like within the biceps point for that test specifically. Nice. Thanks.
Do you mean that the biceps is compensating?
Yeah, it's trying to help out for the fact that the rotator cuff's torn. Yeah. That's why usually like when you look at like pain location, they'll have pain like over the biceps tendon specifically too. Yeah.
Okay, and then the next sequence, again, kind of goes in what I think is kind of an ergonomic efficiency or movement efficiency standpoint. So it goes Hawkins-Kennedy, core cord impingement, Yoakams, where you hide your eyes like this, and then a lift off, where you actually try and lift them off, right? So Hawkins-Kennedy, maybe everyone's pretty good on it. I'll try and make it so I can see. But what I typically see is that some clinicians will be like this, where I'm literally blocking myself with my elbow. Where I need to come is I prevent the shoulder from popping up with my one hand, and then I'm getting my right elbow out of the way so that I can internally rotate in. Right? Yeah. And usually if you do it correctly, it's uncomfortable, right? But